Pallab and Bahar. They're from Nepal Communitere. They're also working with a lot of different things connected to humanitarian aid and making solutions. And they made a really interesting design sprint that developed a number of prototypes. So it would be really nice to hear more about from Pallab. I think Pallab is going to be the first, or Bahar.
I'll just give you guys a brief of Communitere and what we're working on, and then Pallab is going to do the landscaping and sort of sharing what Nepal is doing as a whole. So thank you, Georgia. Thank you all for this opportunity. It's actually very inspiring because I think where Nepal is around sort of the COVID crisis, it's going to be pulling a lot of learnings and experiences from other places and other countries. So as far as Nepal Communitere, we're an innovation hub, a community-based hub. And one of the exciting things that we are going to be doing in the coming months is hopefully bringing in the first fully equipped Fab Lab to Nepal. And I think as the first sort of Nepal Fab Lab, we really want to see how we can increase the digital sort of skills of Nepalis, especially as we're seeing a huge influx of migrant workers that are coming back into the country that will be seeking livelihood, work, and upskilling themselves to be able to enter a different sort of workforce. And so the Fab Lab is something that we're trying to fast track so that it can be a humanitarian Fab Lab used to fabricate emergency health equipment and materials to respond to crises like these. I'm just going to hand it over to Pallab now so that he can sort of share some of the work that's not only happening at Communitere, but also throughout the country as part of the COVID response. Thank you.
Great. Thank you, Bahar.
Hello, everyone. I am Pallab Shrestha, and I'm currently working at Nepal Communitere as an innovation lead. Many digital manufacturing projects like Fab Lab Nepal, auto engineering, and cables with partnership with Field Ready. Professionally, I'm a mechanical engineer, and we are currently engaged with a part of a maker community who are trying to have different solutions to resolving the COVID situations. And firstly, let me share my screen.
Thank you, Pallab. And could you bring your mic closer to your mouth? I'm struggling to hear you.
So can you see my screen?
Perfect.
Yes.
Yep. So firstly, talking about the COVID situation in Nepal, the very first case was on January, and after that, lockdown followed by lockdown and was done in Nepal. And after that, talking about this time, current stage is the community transmission stage. And though the lockdown is released, not released, but loosened up due to some economic conditions. So talking about Nepal, it is in very vulnerable stage already, because it is surrounded by big neighbors, as you know, India and Nepal, which have like very high coronavirus cases. However, the healthcare system of Nepal is quite laid back and has only about like 263 working ventilators in the whole country, out of which majority is located in Kathmandu. According to WHO, like 5% of the cases of COVID requires ventilators, but since Nepal does not have that much ventilators, only 5,000 of the COVID cases only can be handled by Nepal. But as of now, it has crossed about 10,000 cases, and so this means that we need more of the innovation and tech support focusing on healthcare system and logistics. So. So despite the COVID situation, this pandemic has been a catalyst for the innovation in Nepal too. The map that you can see in the screen shows the innovations that is happening around in Nepal. in the map, you can see that almost most of the innovations are happening in this core area of Nepal, that is the Kathmandu. So this shows that Kathmandu, we are not able to like have a democratized fabrication all around in Nepal due to unavailability of different conditions, materials as well as conditions. So so talking about the products, these are some products that were made by different maker communities in Nepal. So I've separated in mainly 7 sectors. And the first one is precaution. Nepal should be focusing its maker efforts in precautions, safety, reuse and testing, because if it goes beyond the limit that we are capable of, it will become very hard, because the health system, as I've already told, is very poor. So so these are some products like the sanitizing tunnel, the foot operated sanitization box, and face masks or elbow operated tabs are the things that were produced. And similarly, there are face shields and PPEs that have been that has been made by the institutions like Nepal Innovation Lab, Nepal Innovation Center, and Protect Nepal. And similarly, those UV boxes which will be used for sterilization of the N95 masks and other equipments, so that the shortage of the mask would not be a problem if we can reuse them. And so for caring, association named Robotic Association Nepal has just launched their first sister robot, which is named Shrestha, as a caring kind of name. And it is used for taking medical supplies or food to the people who are in quarantine. And currently currently government has collaborated with Nepal Innovation Center for bringing this stereolithography apparatus, which is called SLA, a bioresin based 3D printer for making test swabs in Nepal. This was one of the great collaboration of government for import and non-residential Nepali for fund and technical manpower for 3D printing and testing and implementing it in Nepal. Currently, the product is in test and will be very helpful to increase the capacity of testing. The testing booth that you can see in the picture was another idea that was taken from South Korea, which was distributed to more than 45 hospitals in different parts of Nepal. Similarly, the aerosol box and the low-cost ventilators also have been made, but not used right now. And also the body bag is another product in case of death of the COVID patients. The product was handed over to Nepalese army because Nepal's army has been given the authority to handle the dead bodies during the pandemic. So these all molds are done in CAD and use different digital manufacturing technology as well as conventional manufacturing technology according to the suitability as well as the availability. So you can see the 3D printers, laser cutters, CNC routers, and other conventional manufacturing process like injection molding has been used. Similarly, manual stitching has been used for PPE. So talking about our approach and what we tell to different makers is that to focus on strongly on design thinking, that is human-centered design. From this, we can find the actual solution, find the solution that actually solves the real pain point of the users. During the process where we found that SCD, the human-centered design, not only lets you get into the real problem, but at the same time, also improves the reach of your product, because when you go to the people, they know about the product and they continuously get involved during your each iteration. And a mask holder was one of our product. So during the SCD operation with the mask holders, So it was made in CAD and printed simply in a 3D printer. But during the process, what we knew was people are like suggesting their idea as well, so that we can their actual get their actual feeling while developing the product, and that product will be so much useful to those users, and you can see the change and you can see the feel that they have when you hand over that product to the people. So that was one main thing that we learn and also suggest to different maker communities as well. So another thing is, so these are some problems that we have been facing in Kathmandu since we are a landlocked country. So there are very few maker spaces in Kathmandu, in Nepal actually, and like one or two are inside Kathmandu, but not present outside the city. And the tools and equipments are available but limited. There are tools and machines, but they are owned by private companies who are using that to do their process, the production. So we can't access that on a regular basis. And another is unavailability of raw materials and supply chain. Just to tell you that the only 3D printing company and a distributor of filament of Nepal, that is Zenotech, don't have like much raw materials to prototype. All they are stuck in Singapore. Similarly, we had used injection molding to minimize the cost of the face shields. So the injection molding pans are stuck in India. So that was some issues, and it was very hard to find the PET shields that Norris was talking about too. So, and another is innovators can't find enough fund to kickstart the production and distribution. Though they have the idea, it is very hard for them to. And along with that, standardization is one issue with the less guidance in manufacturing practices as well. And due to the market instability, the cheap Chinese as well as Indian products are in the local markets, so that they can't sustain the project that they have started. So that hampers the way makers are thinking. And on the bright side, what we can see is, despite the challenges, makers and innovators are trying their best to address COVID-19 with skills that they have. The government has collaborated for importing of the 3D printer SLA, which is a very good thing, so that we can improve the boundary of testing. There are different products in the market which has gone through prototyping via 3D printing to commercial level, like face shields. Different maker clubs and innovation centers are collaborating with each other. Besides the things that I have mentioned right now, there is IT-related advances like tracking, like COVID tracking, drone rapid response, using different drones for addressing, for mapping, monitoring, and sanitization. So yeah, these are some things that are happening in Nepal. So yeah, I hope from the presentation I was able to give you a gist of maker response in Nepal. Thank you.